Whether you're caring for a spouse who's suffering from memory loss or a parent whose health is rapidly declining, it's important to know services are out there. Creating New Hope is on a mission to inform, educate, and inspire the lives of family caregivers. Join us as we interview industry leaders and experts in the geriatric care space. Our mission is to create hope in the lives of caregivers.
I am Jenny Pardini from Legal Assistance for Seniors and HICAP. I will explain what both of those are. Today we're going to be talking about how to age in place, hiring and working with a caregiver.
This is my favorite topic because so many families right now are moving out of communal living and they are hiring caregivers. So I really want to make sure they do this safely and with all of the right protections in place.
Yes, we agree. So at Legal Assistance for Seniors, our mission is to ensure the independence and dignity of seniors by protecting their legal rights through education, counseling, and advocacy. That is our mission. We do that through legal, community education, and individual Medicare counseling, and all of our services are free of charge. We're a nonprofit that's been serving seniors in Alameda County since 1976. The areas of law that our attorneys can help with are government benefits. If someone is already enrolled in Social Security, SSI, or the Cash Assistance Program for Immigrants, and they have some sort of issue or problem, they can come to us for help. We help with senior immigrant issues, things like renewing green cards, helping with naturalization. If someone has a question about that, just call our office. We'll give you more information. We do elder abuse prevention. So Katie and I get the opportunity to go into the community and talk about what is elder abuse, what are remedies. And then we have the attorneys who do all the legal work on the back end with that. Things like restraining orders, mediation. Another program is our kin caregiver issues. That's helping an adult who's taking care of a minor child. It could be a relative, it may not be a relative, but if they want to get guardianship over a minor child that they're caring for, we can help with that process. Planning for the future is one of my favorite topics. If you are interested, there is a recording of Katie doing it earlier, so I recommend checking that out. And then healthcare coverage. Our attorneys can help if there's an issue with someone's Medicare or Medicare and Medi-Cal together, and there's something that needs to be appealed, if they've had a denial, or if there's some sort of grievance with the care that they were receiving, they can come to us for help. And a lot of referrals come through our HICAP program to that health law department. And then housing. Our housing department is case by case. If you have a question or issue, please just call us. And if we cannot help, we will try to refer you to the appropriate agency who can. HICAP is the Health Insurance Counseling and Advocacy Program. There is a HICAP in every county in California. And if you're outside of California, they may call it your SHIP program, which is State Health Insurance Program. So any Medicare beneficiary can get help with questions around their Medicare. It is unbiased. The most important thing on this slide is that it says free and objective. These are counselors who will meet with you. There's no charge, and they will not tell you to buy certain products or any kind of insurance. We don't sell anything. Our job is to help people understand their Medicare. And then if they have any other insurance, we can help them understand how they work together. We do receive funding from the Area Agency on Aging. Our counselors are registered with the state, and they continually do education so that they are up to date with everything Medicare related. We do appointments at more than 30 physical locations throughout the county due to the shelter in place. We're doing a lot of phone or virtual appointments depending on what people have access to. So someone can call our office and get scheduled for an appointment. And depending on the counselor that they're meeting with and their own tech capabilities, it may be over the phone or virtual. We do provide presentations throughout the county to help people understand their rights and their options. A lot of what we're doing right now is like this, virtual. But if someone has an interest in that, they can contact us for more information. And if someone comes to see a HICAP counselor and it turns out that they've got a bit more complicated of a case that needs some assistance, it may get referred over to our legal department. And then the HICAP counselor would allow the attorney to take over with any, like I said, appeal or something complicated. And again, we just love to say it, all of our services are free. So, home health care. And so there's a difference between what is considered home health care and what is personal care. Home health care is things like physical, occupational, or speech therapy. There's someone who's got training to provide that specific level of care. It's considered skilled. Under skilled care, the patient would be assessed and monitored. It may be that the skilled nursing is also training a family member or even the patient to do some of the medical things, and that would fall under training for home health. Medical social services are going to be home health related, and that can be assistance with financial concerns, government applications. Usually a social worker is the kind of contact that's going to help with that portion. Home health may fall under registered dietitians. If someone has a condition and they're also homebound, then the dietitian would be able to help them and come to them at the home to create a plan. And then home health aid services. So that actually could be someone coming into the home to assist with some things that are not skilled, and that would only be while your illness or injury is being treated. You could receive some limited skilled other care. Now that's different than personal care. And what's important about that is that personal care is what a lot of us think about things we're just going to need as we age. It may be help bathing, dressing, or getting to the restroom or using the restroom. It can be exercise. Transferring and ambulating both are about getting from one place to another, up, across the room, maybe down onto the toilet or down into a chair, and positioning. So we may need help with those things as we're aging. It could be things around the house. It could be housekeeping, food shopping. Maybe I can't get my laundry into the machine anymore or get it transferred over, so I may need help with that. It could be driving to appointments or getting errands done around town. I might need help because maybe I can't drive myself anymore. And then preparing meals, assistance with eating, and also sometimes just company. Having someone there who's going to be able to help when the phone rings or when the mail comes in. So these are all considered personal care items, and we're going to talk about why it's important to look at the difference. Home health care, that skilled care, can be paid for by Medicare. It's going to fall under Part A for people who have Part A. That's going to be fully covered with no copays. If someone does not have Part A, but they do have Part B, then they can get home health covered under their Part B. It's not the same. With A, there's no copays. It's going to be fully covered. If they only have Part B, then they're going to have the same co-insurance and cost sharing as they would for any other Part B service. Durable medical equipment does fall under Part B, even if someone has Part A. So equipment that's going to be related to treatment or recovery is going to fall under Part B, which means there's a 20% co-insurance under original Medicare. If someone has some kind of supplement, then they might not have that same cost sharing, but under original Medicare, there's a 20% co-insurance that someone pays under Part B. And then a lot of people are choosing Part C plans. These are Medicare Advantage plans. They're offered within a geographical area. So for us, it's by the county, within the county of Alameda. There's certain plans. Contra Costa may have other plans. Those plans can vary. So because those plans are competing for your business, some of them are starting to add other things. They may cover, they're going to cover the skilled care, and then they may have some options for covering things outside of skilled care, but it depends on the plan that you have. And the best way to find out is by calling member services, usually the number on the back of your card, and you can ask them if there's coverage for other things under your plan. Those personal care services are not going to be paid for by Medicare. So how can we pay for them? Some people pay privately, the cost out of pocket. They have to decide, and we're going to talk about the different avenues someone may choose to get that care, but the costs can vary based on the way that someone's going to get that care, and if they're paying out of pocket, it's not going to be inexpensive. A person may have a long-term care insurance policy. That's something that they've probably, if they have one, they've probably been paying on it for a while. It's also not inexpensive, but if you have it, when it's triggered by certain conditions, which we'll also talk about, then that plan is going to kick in and start paying for some of the care. If someone qualifies for Medi-Cal, if they meet the income and asset requirements to qualify for Medi-Cal, they can have a doctor say that they need support, and through in-home support services, they will be able to receive personal care. And that's between them and the doctor to figure out how many hours they need and what kind of services. You are your own best advocate, and your doctor is your second best advocate. Did you have a question?
Yes. With the long-term care insurance, I have heard of scenarios where folks were having a hard time reaching their long-term care insurance and having them return calls or help administer those policies and get through those waiting periods. Now, can they call HICAP if they need some help?
Yes.
Okay, good.
Yes. So that is one of the areas where we have counselors who are specially trained outside of their specific Medicare knowledge. They go through additional training to understand what long-term care policies are and how they work. And I would say the most common scenarios that we get calls for are two things. Someone who's had their plan for maybe like 30 years, they've been paying for it, and now they're thinking they might need it. And they go, I don't even remember what was in this thing. Help me figure it out, right? Or their adult child is trying to help that parent who's had a policy, and they go, I don't even know what this stuff is. Can someone help me figure it out? No, those aren't the only reasons someone might call HICAP for help with this, but those are pretty common. We're happy to sit down with someone, answer their questions, help them understand how it works. Some people can consult us also before they purchase a policy if they just want more information about how it works. Again, we don't sell any products, so they wouldn't come to us to buy long-term care insurance, but we're happy to help them understand it.
Yes, I know from my own experience dealing with CalPERS and getting them to pay the claims and get the paperwork filed. As soon as I mentioned HICAP, they were quick to answer my calls and my emails.
And just for extra fun information, if someone is considering buying a policy, they are supposed to be given paperwork that gives them the HICAP phone number so that they can call if they have questions. And that is something insurance agents are supposed to do when they're working with a client who's interested in that product.
Okay.
And then Medicare Advantage plans, and this is sort of what I was talking about as I was on the other side of the column here, may pay for limited care, personal care, under certain circumstances. And that just depends on the policy that they have. So if it's skilled care, a Part C plan is going to be obligated to pay for it just like Medicare would. If it comes to those personal care, it's going to depend on the plan and what they wrote into your policy when you signed up. And then if someone served during wartime, they can qualify through the VA for aid and attendance, which is also a source of paying for personal care. So the Center for Medicare Advocacy is a great watchdog for some of the things that Medicare is supposed to do. And they want people to know home health care coverage can be appealed if it's denied. So if Medicare says, oh, no, you don't qualify, but then you meet any of these criteria, you can say, well, Medicare, I would like you to reconsider that. Or you can come to us for help. We can help with that. So if a physician has signed off on your care plan and says that the care is medically necessary, and as long as they've met with you face-to-face, and it's either 90 days prior or 30 days after the start that the care is supposed to happen. Now, not everyone's meeting with their physicians face-to-face because we're sheltering in place. So there's certain things that are being relaxed with Medicare right now about phone and telehealth. This is the time when you could make an argument that that virtual appointment could be considered face-to-face. If the patient is homebound, then that's also another reason that you could appeal this. Now, homebound doesn't mean bedbound, and it doesn't mean that they're never allowed to leave the house. They may go on walks around the block. They may be able to get out and do things like adult daycare. But if there's something making it very difficult to get out of the house and do things that would regularly be done by people who are able to go out, they can make an argument under this part. The patient can, if they need skilled care on an intermittent basis, meaning it's less than 7 days a week, but at least once every 60 days, or it could, there's a little asterisk down there, it could be that it is daily, but it's going to be for 21 days or less. It could be that they need a couple of different things on any given day, so they're going to have different people coming in to provide that home health. Those are all allowable. The care has to be provided by a Medicare certified provider. So it does have to be provided by an agency who can bill Medicare. That's really important. If they can't bill Medicare, they can't come and provide you and charge Medicare, right? So if a person does need home health and they meet these criterion, they can appeal if their initial request is denied. The previous slide was slide 6, and there were some triggering conditions above, so that they would be entitled to Medicare health coverage. So there's some more stuff from the Center for Medicare Advocacy on the next slide. And that is Medicare coverage should not be denied because the patient's condition is chronic or stable, meaning, and there was a case called Jimmo versus Sebelius, saying that restorative potential is not necessary. So the person may need that care so that they don't decline. There's nothing that says that they have to improve to their original function to be able to receive skilled care.
Now,
yes.
if a new condition happens, does the time restart?
So they would need to work with their doctor to add in any additional care. You can extend the home health care period. So there's not really time limits. They'll say like, oh, it needs to be intermittent and not long-term care. But as things progress and things change with our bodies, if our doctor is willing to make the case for us that we need these things, we can continue home health in various ways.
Yes. So I'm thinking about my great grandmother, 96. She has been with Gateway Home Health, and they've been incredible taking care of her. And she had a fall 2 weeks ago, broke her femur. So now she's going to be in rehab for a while. But I'm hoping that once she gets home, we'll be able to get everybody back in the house. And I guess the COVID thing, we have to think about that too. But I need her to be able to have access to physical therapy when she's home and to continue to stay mobile.
Yes. And that care is considered essential care anyway, so she should be able to continue to get those services from someone who can come to the house. It's different if it's physical therapy, it's very hands-on. You need someone who can make sure you're doing exercises correctly, versus maybe speech therapy could be over video. Yes, Katie Brady, who's I think going to comment about her current experience with therapy.
No, I just wanted to comment about that. The big change with Sebelius, it was that if people were kind of reached a plateau with their physical therapy or that's it, treatment stops. The Sebelius ruling came into being and said, no, you don't need to show improvement. You just need to maintain. And so places were kicking seniors out because, well, you're not getting any better. You don't get more therapy. And Sebelius sued Health and Human Services and won. If you need
Jimmo.
that, Jimmo, I'm sorry, Jimmy sued Sebelius. There you go.
Yeah.
If you need that level of care to maintain your independence and current status of where you are, then Medicare will pay. But again, as Jenny said before, your doctor is your second best advocate behind yourself.
And what if the doctor at, let's say, the skilled nursing facility is saying, hey, you're taking up a bed, you've kind of plateaued, or you have dementia, you're denying, you don't want, you're maybe on the aggressive side and you're saying, no, leave me alone. I don't want to do this. Take this weight ball and all of these tools. Would that be a situation where
I would work with the primary care physician and not the skilled nursing's physician. I mean, obviously that person is part of the team. But when it comes to talking about someone who knows you and knows your medical history and knows what's normal for you or what needs, improvement or needs to even just not decline, your primary care physician is the one I would work most closely with.
Okay.
Yeah. Especially if it's where they're going to cut the care and treatment. You can call us.
Call us.
Yeah, call us with that one.
Yeah.
It's one thing if the patient denies care, but if the facility is denying care to a patient who fully still needs it, then you can give us a call too.
Okay.
We're good with that.
And I'll even say further on that, the patient can deny care, but if the patient doesn't have capacity and someone else is managing their health, their finances, any of those things, then the person who's working as their agent can work with the doctor on behalf of the person who may not be cognitively aware enough to understand that they do need the physical therapy or whatever is in question. So, if you are considered, normal cognitive functioning, you always have the right to make a bad decision. Right? That's what we do. We're grown-ups and we can make our own decisions. But if you cross into a line where you're not really understanding the decisions you're making, and there's something cognitive going on, then it's going to possibly be someone else who assists with making those decisions for the person.
Yeah. And then, I also worry about during this COVID era, I know for sure for my scenario, I'm definitely going to have a FaceTime call with the physical therapist so we can actually see how much my great grandmother has progressed and is she ready to come home or not? And what is that going to look like?
Yeah. Yes, Katie.
Okay, my current situation, I recently had knee surgery, and I have a 95-year-old mother-in-law that we visit, and provide stuff for, whatever. After 3 weeks, I was supposed to start going to a physical therapy outpatient unit. In the era of COVID-19, now I'm sure it's very health plan specific, your insurance specific, but I requested I don't not have to go out and get exposed to something that I might bring to her. And my insurance company said, fine, I've got physical therapy coming to my home for 3 more weeks instead of me going to the facility. Now that's unheard of, but it has to do with COVID-19. And so if you have a client or a patient that you're concerned about, risk exposure, if they have to go out for physical therapy, you can fight to bring them home.
Yeah.
To bring the therapy to them.
So bringing it back to the third bubble, and we covered this a
Sorry.
bit already. No, it's fine. I just didn't want people
Okay.
to get like, what are they talking about now? So you can get the time period extended. It's not a hard number. It depends on where you are with your improvement, what your doctor says you need, all of that. So you work as a team. And then the doctor is the patient's most important ally. They're going to know what to write on the right paperwork to say that you need things. And if you're not getting what you need or you disagree with that, please come to HICAP and we'll see if we can help with an appeal. And then in order to be able to appeal something, it has to have at least been filed as a claim. So you have to request in writing that the home health agency file a Medicare claim, even if the agency insists that Medicare is going to deny the coverage. Say, that's fine. Can you please write it anyway? Because once that claim gets denied, now you have the right to move forward through these processes. So there's a lot of things you want to consider when deciding if you're going to need some personal care. You have to assess where the person's at and what are possible needs that they're going to have moving forward. Stop and think about what is the quality of life that you want to have. If you want to be able to go into your garden and spend some time outside, and that brings meaning and joy to your life, what are you going to need physically or by support to be able to go do that? Determine the level of assistance that's needed, and then write down those needs and limitations that are going to affect you being able to do the things that you want to do in your life. Consider your likes and dislikes, write down your expectations. Like, you might not be riding roller coasters anymore, that's okay, but what's important and what do you need to be able to do what matters to you now and moving forward? Think about your needs versus your wants. This part is really important. We can want a lot of things, and if you have lots of money, you can pay for all of your wants. But if you're working on a budget, which I think most families are, you have to think about what you actually need and how you're going to get that. And if you can work in your wants as well, or some of your wants, that's even better. But really bringing it down to what is the most important thing for making all of my abilities happen, like getting to the bathroom. And then discuss it with your doctor and get authorization or recommendations from that primary care or your medical professionals. So there's a couple little asterisks here, which are Medicare does require a doctor's authorization to get home health care services. The doctor has to say you need it. If you have a long-term care insurance policy, they're also going to require a doctor's report confirming that you need personal care services. And if you have Medi-Cal, again, you're going to have to work with that doctor to say that you need those in-home support services. So the variety of avenues you might take to get these things, you see the doctor is always part of moving forward. If you don't have that, it's going to be very challenging to get any of these things to pay. You can always pay out of pocket, but if you want any of these sources to pay, they need that doctor. And so other things you should consider would be determining who is going to pay for the care and for how long. Am I going to pay for my own care? Do I have adult children who are going to help pay for my care? How long are they willing to do that? For the next year, 2 years, 3 years? At what cost, right? These are all questions that swim in our head. And it's a lot to think about sometimes. But if we can write these things down and kind of work through them ahead of time, we can create, the next point here, a realistic budget. What are we looking at for care? And then you have some options. If you are going to go the route of using an agency, you do want to find a reputable agency. If you're hiring privately, you're going to have to consider a lot more things that do normally get taken care of through the agency. Who is the boss? You have to decide who's responsible for hiring the caregiver, who's going to take end of the day reports, end of the week reports, responsible to communicate how things are going, who's going to be the one communicating the duties with that caregiver. And if the person is using an agency, then who's going to be the point of contact between the person and the agency. An important note is that power over a person's care decisions should lie with that person as much as they have the capacity to make those decisions. So, if it's mostly physical limitations, but the person is still very sharp, able to make a lot of cognitive decisions on their own, we want to give them power over the decisions that are happening in their life. If there are some things that are affecting that, and maybe other people have to step in to help make some of the decisions, you don't want to completely bulldoze the person receiving care. Like, you have to find ways to still incorporate them so that they are okay and comfortable moving forward with receiving care at all, because that can be a resistance point. And then how do you find a caregiver? Well, we're going to talk about a couple different ways. If a person decides to use an agency, they can look for agencies in their area. You want to make sure that it is licensed by the state. You might want information about how long they've been in business, who they work with, are the caregivers licensed and insured? And you want to know how they train and supervise and even monitor those caregivers. Those are really important questions to understand when you're working with an agency. You can ask an agency to send you information. You don't have to meet with them right away. They can send you information. You can look through, decide which agencies you want to even meet with face-to-face. Some agencies will allow you to set up some trial services to see if it's a good fit. I just want to make sure I'm really clear. I don't mean free services, right? But without signing a contract or selecting a specific caregiver, you can set up some trial stuff to see if having a caregiver come in is going to be a good fit. Is there going to be resistance from the person receiving care? Are the caregivers that are coming in seeming like they could be someone they could work with long-term? Do you want to try someone else out, a different agency or a different caregiver? And then you can really think about what services are important to you. And just to stay on that topic for a second, if you're going to try it out and you are taking the time to plan and think about this, do it when you're not in a moment of crisis. Like, if you see that there are needs that you're starting to have or think you may have in the near future, don't wait till you fall and break your hip, right? Start trying out some of these agencies so that you know that if there is a crisis moment, you know who to call and who you want to work with, and it's not a scramble and a surprise and a really big challenge for everyone who's trying to help. There's also a caregiver registry. We provided a number there. And then there's also a website listed. So you can check out the caregiver registry. And that is a list. It's basically a list of people who do caregiving, and you can hire from the list, but you would be responsible for employing them, or figuring out any of the services you want from them, what they're qualified to do, what they're capable to do. That would be between you and the person you choose off the registry.
So in terms of the registry, are they background screened? What extent of vetting is done on this registry?
So I believe if it's from the registry that's tied to people who qualify to provide IHSS services, then there's some background stuff that's been done. I don't know everything that they ask them, but it would be someone who's been vetted to some point. So it's different than just picking up the phone book and calling someone and say, hey, are you free to caregive? There's some sort of level of vetting that's happened. But I don't personally know the difference between what the caregiver registry vets and what an agency would vet for.
I know that agencies will do live scan, and I would assume that the caregiver, I think IHSS caregivers have to do live scan as well.
Yeah.
And I know the cost, I don't know what you guys are seeing in terms of costs, but for agencies, they're typically charging anywhere from $28 to $35 an hour with a 4-hour minimum.
And we'll talk about that a little bit more, but that's definitely the number I would use. And then some people who are looking for caregivers and don't want to use either of those other paths may go to a local college that has a nursing program, or a community college that has a home health or CNA training program, because they may be able to find someone through those avenues who would be a good fit. There's a lot of stuff to consider to decide what a good fit even is. These are some other, we'll cover this and then we'll talk about some more of the things that just sort of got brought up. But some people get a personal referral. They may ask a friend or neighbor or someone else who they know who's employed a caregiver before. They might go to their community. It could be something like Nextdoor. a local community webpage. There are Facebook groups for various communities. Senior centers may have some information about people who've been caregivers or who they can call for caregiving. And some people go through things like their local house of worship, their faith community. You can also contact the Area Agency on Aging and ask for recommendations. And then back to that in-home support services. So if someone does have Medi-Cal, then there is a provider list through the public authority. You can call them and ask who's available. It could also be a family member or friend or neighbor who could be your caregiver that gets paid by IHSS. They just have to go through a process to be approved to be that caregiver. But that's one way that a family member who is providing that support, and a lot of the times already providing that support, may be able to be paid to be the person's caregiver. And then locally in Alameda County, there's a couple of resources. There's a program called Easy Does It. They're Berkeley based, and they're really mostly supposed to stick within Berkeley, but they sometimes will make referrals and work with people who are on the border areas of Berkeley. But in an emergency, like you could call them in the middle of the night if you had a fall, getting out of bed to go to the bathroom in the middle of the night, and there's an emergency and they need a caregiver over there to help assist with some things, they could get emergency service through Easy Does It. Jay Say it has a caregiver directory. I put their phone number up there. They also have a website. When I designed this slide, we were not in shelter in place, so you are welcome to look them up. You can Google them if you want to try and look at their website. But there's a person who answers that phone number at their agency who is the person in charge of caregiver directory. And then there's the Family Caregiver Alliance, and the phone number is also there, but you can Google them as well, and you'll get information for their website. If you go the route of working with an agency, we're going to look at some of the benefits and challenges. So things that can be facilitated and made easier by an agency are help with the care plan. You'll have a case manager. They do pre-screen their workers. You can have a pool of people with relevant experience for a variety of needs. And if someone is sick or is going on vacation, they're going to have access to backup care. There's ability to change the caregiver quickly if the client needs a change, or maybe the caregiver leaves the agency. There'll be a replacement that can come in a lot faster than having to hire a new person. There is someone to report to at that agency who can help solve issues. There's some liability protection because they should be with the state, they should have insurance, and then there's no paperwork or payroll or tax information that you, the employer, would have to figure out because the agency is going to manage all of that for you. But there are some challenges. It's expensive. We talked about that. It's going to be somewhere in the Bay Area, most likely between $28 and $35, and that's per hour. A lot of them do have a minimum amount of hours you have to have per day if on the days that you're going to get services. The choices in staff are going to be limited to who works for that agency. There's less flexibility around the duties, hours, and overtime. So some of those things when you hire privately, you can negotiate a little bit differently than what an agency has as rules for their employees. The minimum I've heard from any agency that I've ever talked to is 4 hours. So whether or not you actually need 4 hours of service, you're going to pay for 4 hours of someone to come, and you want to try and use that as effectively as possible. If you're going to have someone come, think about if they're going to come help you with certain physical things during those hours, what other tasks for personal care might they be able to help with to make that 4-hour value worth it for you. They may schedule more than one attendant if the work hours are not consistent. So if you have sort of intermittent needs where you're calling people in and you may not always have the same person, and then you might have to help train that each new person that comes in. And then, there's staff turnover. So it's less, not that someone who works with you privately couldn't also quit, but there's less control over that relationship. And they may limit certain tasks that can be done or charge more for specific tasks. So this is some of the things to think about if you're considering working with an agency. If you decide to use the registry or a personal referral, so if you're going to hire privately or outside of an agency, you might be able to find someone who speaks other languages or shares interests with the person who's going to be receiving the care. They may be more flexible about their hours, around part-time or unusual schedules. You may spend less money because the amount you're paying is directly to the person, so you're not paying the agency. If you use the registry, some registries do have a one-time fee, but then that's it, you'd be done. But you're not paying an agency, so you may even be able to pay a higher wage to that caregiver than what they would have received by working through an agency. And then you have an ability to set your own rules and expectations. If you are hiring independently, you have to consider a lot of other costs that are not just the cost of paying the person. So you also are going to be responsible as an employer to withhold taxes and look at insurance and all kinds of other things. So we just want to make sure people understand that you are an employer. If you hire someone privately, you are an employer. There are some challenges. It could take longer to find someone. Where are you looking? What kind of interview process are you running? How do you know when it's a good fit, right? So some of these questions that could make the process take longer. You're responsible for calling their references and or doing a background check. So there's a resource there to do background checks. I'm going to be very careful in how I say this, but one of the agencies that we talk to a lot in developing this presentation is called Hand in Hand, and they work with people who do domestic work. And they're a great agency, and they can help people understand how to be an employer and how to write up contracts. And a point that they like to make, so I will just share it, is that, you know, when you're hiring someone on your own, you might be hiring someone who doesn't have the correct paperwork to be hired. Now, we're a legal agency. We're not recommending anyone do anything illegal. But if someone goes that route, then doing a background check could be very prohibitive. So they do recommend, instead of a background check, doing something like just asking for references of people who know the person and calling the references, because depending on everyone's situation, things are different, but a background check may not be able to provide much information. If you're hiring privately and there's an emergency or someone's going on a vacation and there's going to need to be coverage, then there could be challenges in finding who's going to step in. And then there's that paperwork. I don't want people to be scared of the paperwork. There's no problem in making the commitment to do this, but when you hire privately, you are an employer. If you're going to be paying someone for a certain amount of hours, then you will need an employer identification number. You'll need to do withholding, and you'll need to make sure that taxes are paid. And that's, you know, for everyone going through the appropriate legal route. You do need to get liability and or workers' compensation insurance for protection. There's the possible cost of actually training the caregiver, depending on what skills they're already coming with and what training they have. And ultimately, you are responsible for any complaints about care. So you have to be willing to have sometimes difficult conversations to make sure that everyone's needs are getting met and that everyone understands obligations. And so it's cutting out that built-in person who may exist if the person goes through the agency. This is actually, it's a lot of information on this one. It's job description tips from Family Caregiver Alliance. I'm not going to read them all to you. This is actually one that if we were doing this live, we would give out as a handout, because there's so much information and there's so much to think about on this slide. You have to consider certain things, and it's really helpful in those initial planning stages that we were talking about, where you're thinking about what are your needs, what is your budget. If you can think through some of these things, it'll help you move forward deciding how you want to hire, who you want to hire, and what process you're going to use to be engaged with that caregiver, whether it's an agency or private, and help set expectations. Yes.
So I'm just looking at the handout in terms of wages. So with AB 5 in consideration with the state of California, I'm assuming that we cannot do contract 1099 employees anymore. So if someone thinks that they're going to hire a caregiver, I'm just going to pay them 1099. I don't have to worry about, you know, taxes, insurance, and workers' comp and unemployment. That is no longer the case.
Yes, and actually at this point, if you have questions about that, I would say the best agency I could refer to is the one I mentioned, Hand in Hand.
Okay.
They help people design contracts. They've got some samples and examples you can use. So you an employee, so not necessarily 1099, but any kind of employee contract with any kind of domestic worker. They help with, you know, nannies and people who come in to do house cleaning and all of those kind of people, any kind of domestic employment, which caregiving is going to fall under if you hire privately. They will help you with questions around that. So okay. We at LAS are not the experts on the legal employment law for hiring your caregiver, but we want to make sure people are thinking about those things and asking the right questions so that they don't get themselves into any kind of legal trouble. And then this is if someone is in an assisted living facility or nursing home, They're going to be receiving certain types of care based on the fact that they live there, but some of them may choose to also hire a caregiver to come in with and assist with other tasks. Now, that's not cheap. Again, like these are things where you'd have to have the budget for it. And we know that the cost in the Bay Area for being in a nursing home is pretty high already. But if the family can't get there and they want to make sure, mom's getting some extra care and some extra attention, they may want to hire someone to come in with that. That is allowed. They can provide more personalized care, more support directly to the client. Many facilities do an excellent job, but their individual attention is limited because there's more than one person that they have to take care of. And the costs, if you're looking at, if you're already looking at being in a facility, you're looking at somewhere between $3,000 and $10,000 a month easily in this area. And then you'd have to consider that extra cost of what you're going to pay that person to come in and do extra care.
And I would even say that care is limited based on whatever that specific community wants to say, companion care. So they may not be able to lift or use a Hoyer or even change their briefs or anything like that. It is, yes, like sometimes it's just strictly companion.
Yeah, so it would be important to consult the location where the person is living. And then from our legal team, we want you to remember that caregivers are employees, whether you hire them through an agency or you hire them on your own. They are an employee. There are labor laws that apply. You have to be conscious of things like sick time, overtime, and minimum wage. And you should always maintain proper documentation of the hours worked and the payment made to the caregiver, just in case there's an issue. So keep documentation. This is another resource page, so I'm not going to read everything on it, but there's a lot of places you can go to get more information beyond this presentation. The Medicare website obviously is going to be helpful. About halfway down the page, you can see the information for Hand in Hand, which I've mentioned a couple of times now. And then right below them is Canner, and that's another one that we make referrals to all the time. They're a fantastic organization. They can answer all kinds of questions about nursing home, assisted living. They know lots about Medi-Cal, and they have elder law attorneys who they can make referrals to. They usually, I think, provide up to an hour of free consultation on certain issues. So if you have questions, check out their website, call their phone number. They are an amazing organization. There's some other resources here. Like I said, I won't read you the whole page, but this would be a handout we would normally provide in person. Sorry, y'all. And then our information. So if you need to speak to someone at LAS or you would like an appointment with a HICAP counselor, you can call our office number, which is the first number in bold there. And then there's a statewide number. So if you are listening to this outside of Alameda County and you would like to talk to your local HICAP, call that 800 number and it will route you to the number associated with your county, to the agency associated with your county. You can always visit our website for information. If you heard all of this and you're like, wow, I wish I could talk to people about Medicare. That sounds amazing. I feel like I'd be so helpful. Give us a call. We have volunteer counselors. They run that HICAP program. We could not do what we do without them. So we really rely on our amazing volunteers. And then if you were like, oh my goodness, this is just the greatest information and I have to hear more from this person, we offer a variety of topics that we cover at our agency. So if you contact our community education department, you'll get Katie or myself, and we can let people know what we're available to present, whether it's virtually or in person when that's allowed.
Perfect. Thank you so much for your guys' time with this topic. This is just so timely. So many people need so much help. So I just have one last question. For what are those middle income folks who they can't qualify for IHSS, they're not veterans, where do you guys point them?
It's challenging because that's one of the issues with like long-term care insurance is it only makes sense to even buy that product if you have a certain level of assets and income that would make sense for you to try and maintain and protect by using that kind of insurance. And a lot of people don't fall into that, but they also don't necessarily meet those income and asset requirements for Medi-Cal.
Yeah.
And so that's where you're figuring out these things about how are you going to pay, who are you, who's going to pay, what level of care is needed, what can you afford versus what you'd really like to have. And that's pretty much what the content of this presentation is for, is those ways that you can at least try and find someone to provide care when you don't have those other resources, whether it be on the high end or the low end. And that's most people. Most people fall into that middle. And we would tell them, here's some information like we gave today about hiring versus, an agency versus private and what you can do. And that's really, unfortunately, the scope of what we provide as an agency.
Now, have you guys seen a lot of those, they're starting to call them, I know there's that website, ILA, Independent Living Association.
I haven't seen them. Tell me more.
Alameda County has Independent Living Association, where they're like the golden girls of communal living. They're not licensed RCFEs, but, they'll have, a couple folks, as long as they can manage their own medication, maybe 2 to a room, where like an RCFE would not go for that.
Right.
There's certain, parameters they would have to be as far as square footage and space. But they'll have like shared caregivers in these houses. And I'm like, How are you guys doing that legally?
Well, I'm thinking a lot of people, the question that you answered, we don't have a good answer for it. And that's the way our society treats seniors. So another concern is that seniors who are maybe poor month to month because low income, but they're sitting on a house that's valued at $1 million or $800,000. So they're renting out rooms to their girlfriends. Like you said, the Golden Girls scenario. We are cautioning seniors to be very, very careful. If you come into an agreement to rent a room to somebody, you become a landlord.
Yeah.
And that creates a whole nother thing. So the series of how are they doing it legally? I don't know. And then you also have like 30,000 people living in, what's the big one in Walnut Creek, in Rossmore.
Yeah.
That's kind of the old commune and format. So seniors are going to think out of the box. They're going to figure out, I hope, how to do this. The ones who are truly isolated and really alone, I don't have an answer. If
now,
you don't have family or friends that can help you, how do you afford it on a low income?
What about assisted living waiver? Do you guys help with that? If somebody is like, I have seen scenarios where, if they can get qualified for Medicare, if they were able to write off a certain expenditure, here or there with.
Okay, I'm just going to stop you real quick right there, because Medicare, they should be qualified for simply based on age or disability, but Medi-Cal.
Oh, Medi-Cal, sorry.
Yeah.
Medi-Cal.
I just want to be super clear when we're sharing this information. So some people who apply for Medi-Cal because they do meet the asset requirement, and I will even go further and say, when Medi-Cal is qualifying you, they don't care, as long as you only have one house in your name, they don't care about the value of that house. They're not looking at it. So we don't want to scare people away from applying for Medi-Cal because they have $1 million house they're sitting on. They still need somewhere to live. So Medi-Cal is not looking at that. They're going to look at money in the bank for the most part. So as someone meets those asset requirements with Medi-Cal, but their income is slightly over the income requirement, they can still apply, and they may get what is called Medi-Cal with a share of cost.
Mm-hmm.
That's like a whole topic I could talk a lot about, but we don't necessarily want to talk about that today. But I will say this: if someone applies for Medi-Cal and they receive a letter that says, "We'll give you Medi-Cal, but with a share of cost," call HICAP.
Okay. And how about if they're denied?
Well, let me finish one thought, and then so there are strategies you can use to eliminate a share of cost, whether it's an additional insurance product or grouping bills together or whatever. There's a lot of strategies. Please call us. We want to help you understand your options.
Okay, good. Because I see a lot of folks go to pay thousands of dollars for Medicare counseling from attorneys, and they don't even have that $10,000 or whatever it is. And I'm like, you should have called HICAP.
Yeah. And I see that too. And I am always like, we would have done this for free. Like happily, we would have answered all your questions for free. And so, I know people got to put food on their own tables and charge for all kinds of different things, but like, please take advantage of free HICAP services. They're free because you paid your taxes.
That's right.
And we're paid for and funded through federal and state money. So you paid for it already. So please come use it. I know we say it's free, but you already paid for it.
That's right. We just don't charge at this point.
Yeah. And as far as if someone's denied for Medi-Cal, it's really going to depend on what the reasons that they're being denied for are. And it could be that Medi-Cal is working off some sort of old information that's not accurate. No, that's where I'm going to say we are not Medi-Cal. We don't qualify people for Medi-Cal. So that is something that has to be done through the county social service offices. But if someone got that and didn't really understand like why they can't get
Why?
Medi-Cal to go with their Medicare, we may be able to help them understand a little bit sort of around that, but we wouldn't be able to get them qualified. They would still have to do that through social services.
Okay.
Yeah.
All right, good. Well, I think that's all the questions I had for you guys. Thank you. This is so informative and it's going to be so useful to so many people. Just
Great. And we are Medicare nerds. We will answer, like, we love talking about Medicare. So really, if you have a question or you want to know anything, call us, because you start asking us questions and you're going to get a lot of information. I think I'm really fun at a dinner party, and my wife tunes out. God, please stop talking about Medicare.
Yeah.
So,
yeah.
And if we don't know the answer, you can bet we will go to the ends of the earth if we have to try and find the answer.
yeah.
Great.
So,
Thank you.
yeah.
Thank you so much, ladies. I appreciate your guys' time.
Thank you for having us.
Thank you.
Thank you.
All right. Bye.
Okay. Bye.